Let's begin with fundamentals in gynecology. So first in fundamentals in gynecology, we need to start with embryology. So in the embryology, the first thing which you see is till 6 weeks, the conceptious which has formed is bipotential. That is, either it can turn into male or into female. So till 6 weeks, it is undifferentiated. That is the 6 weeks of intrauterine life, the conceptious is undifferentiated. But after 6 weeks, the differentiated into male or female. So after 6 weeks, it can differentiate either into male or female, and the sex of the conceptious is determined by SRY region. And the SRY region, we know it is present in Y chromosome, short arm of Y chromosome, but especially in the distal end, that is important. In the distal end of short arm of Y chromosome, you have this SRY region. So till 6 weeks, the intrauterine life, it is bipotential, it is undifferentiated. But after 6 weeks, it is differentiated into male and female. And whenever there is SRY region, that is whenever there is Y chromosome, that means there is SRY region. So it will differentiate into male. If there is no SRY region, that is no Y region, then it is a female. So this is the thing which we need to see. Now coming to the important one is on Y chromosome short term, on distal end especially, we have our SRY region. So if Y chromosome is present, then the fetus is male. If Y chromosome is absent, then the fetus is female. And the gonads in the male are testes and the gonads in the female are ovary. Now coming to a special situation, that is a Turner's syndrome. So in Turner's syndrome, it is 45XO. Means normally we should have only 46. We have in total normal 46 chromosome, right? It is normal. But here you can see 45XO means 45, 46, 47. So it is an abnormality. It is a Turner syndrome where the baby is female baby. Why it is female baby? Because you can see the X here. There is no Y. So it is a female baby and it is a Turner syndrome. Next coming to Klinefelter syndrome. So how to remember Turner syndrome is female? Remember female is turning. Okay. And Klinefelter syndrome, here the number is 47. XXY means it is, you can see 47, 48, 49, total 50 chromosomes. So it is an abnormality. And how to say whether it's a male or female baby? You can see here the Y chromosome. So it is a male baby. Even though it has X chromosome, 2X chromosome, but as Y chromosome at least one is present, you can say it is a male baby. So Turner syndrome is a female baby, Klinefelter syndrome is a male baby. Now coming to for proper development of ovaries, both the X chromosome should be present. So of course you say XX means female, right, normally. So 2XX are important for the female because for proper development of ovaries. Both the XX chromosome should be present, although both the XX are not needed for presence of ovary. So what does it mean? For proper development we need both, but even at least one is present, it's enough to form an ovary. Okay. So coming to Turner's syndrome, in Turner's syndrome, the only X chromosome is only one X chromosome is present and ovaries are developed. As there is only one X chromosome, as we said, we need two for proper development, but there is only one X chromosome in Turner syndrome. So here, the gonads are called as streak gonads. So streak gonads are seen in Turner syndrome. Now coming to natural tendency of conceptious. Naturally, if Y chromosome is not there naturally, then the natural tendency of conceptious is always to become a female. But as the SRY region is coming, that's why it is turning into male. Okay. So now coming to testes. So when testes is formed, in male, the testis is formed by 6 to 7 weeks. So I said till 6 weeks it is bipotential, right? So from 6 to 7 weeks it is turning into testis if SRY region. If no SRY region, then ovary is formed from 7 to 8 weeks. So it is an order you can remember. First 6 weeks bipotential, 6 to 7 weeks testis, 7 to 8 weeks ovary. Okay, and along with this SRY genes, there are some other genes which are helping, especially for the testis formation. There is helping of SOX. SOX9 gene. So we have SRY and SOX9 gene. Whereas coming to helper genes in the case of ovary is the helping gene is WENT WNT, WENT4 and RSPO1, RSPO1. Okay, so these are the two genes which are helping for formation of ovary. So SOX9 for testis, WENT4, RSPO1 for ovary. These are helping genes. Now gonads are formed from genital ridge. We know that genital ridge, 3 weeks in the yolk sac, by 6 week they will go to genital ridge, right? So the gonads are formed from the genital ridge, which is derived from intermediate mesoderm. So what point you need to write here now is gonads are derived from intermediate mesoderm. Okay, so gonads are formed from intermediate mesoderm. Now coming to genital ridge. Genital ridge are first seen at 5 weeks of gestation. So in 5 weeks of gestation, you can see the genital ridge. Most of the female genital tract are mesodermal in origin. So most of the female genital tract is mesodermal in origin, except the parts which are derived from urogenital sinus. So the parts which are derived from urogenital sinus, that is of endodermal origin. Okay, so the parts of the female genital tract are mesodermal origin, except the parts which are derived from urogenital sinus, which are of endodermal origin. Now the germ cells are present in gonads, right? You know that the germ cells are present in gonads, and these germ cells are derived from primitive ectoderm. It is derived from primitive ectoderm, or you can say epiplast. So from epiplast or primitive ectoderm, you are getting the germ cells. At the 3rd week, it will reach the yolk sac. Here I said 3rd week it will reach the yolk sac. 6 weeks it will reach the genital ridge. Okay, so germ cells are present in gonads, and germ cells are derived from ectoderm or epiblast. Okay, now coming to ducts which are involved in development. So the ducts which are involved in development till 6 weeks of pregnancy, there are 2 pairs of ducts, and that ducts are present in conceptus irrespective of gender, that is in male and female. 2 pairs of ducts are present till 6 weeks. The 1 pair of Wolffian ducts is also called as mesonephric duct. Okay, and 1 pair of Mullerian or paramesonephric. So wolf, how to remember this? Actually Wolffian duct is present mostly in male, so wolf like male, and Mullerian is present in female. So Wolffian duct is also called as mesonephric duct, and Mullerian duct is also called as paramesonephric duct. Okay, so 1 pair are present in male and female. So at 9 weeks 1 pair will disappear. So in 9 weeks, as we said, 6 weeks 2 pairs are present, but in 9 weeks only 1 pair, that is in male only you will have Wolffian duct, and in female you will have only Mullerian duct. And coming to 10 weeks, the internal genitalia are formed from this duct. So of course from Wolffian duct, male internal genitalia; from Mullerian duct, female internal genitalia. Okay, so 10th week internal genitalia are formed. Now coming to males. So in males, the presence of Y chromosome, that is SRY region, is present, also known as testis determining region. So SRY region is called testis determining region, and gonads will be testis. So testis, it will divide, and it is having 2 types of cells, that is Sertoli cells and another one is Lydic cells. So Sertoli cells mainly forms a MIS, that is Mullerian inhibiting substance or anti-Mullerian hormone. So these are produced by 7 weeks, and they'll act locally, that is they are paracrine. They inhibit the ipsilateral Mullerian duct. For example, right side will inhibit right side, left side will inhibit left side. So Mullerian inhibiting substance or anti-Mullerian hormone secreted by Sertoli cells. Coming to Lydic cells will secrete testosterone. Okay, it will begin at 8 weeks and it is maximum at 15 to 18 weeks. Okay, so now coming to the MIS. So we have discussed about this Mullerian inhibiting substance or anti-Mullerian hormone which is released from Genital cells. This will lead to regression of Mullerian ducts in male. So it will decrease the Mullerian ducts in male. Okay, that's what it should decrease, right? Because Mullerian ducts is present, actually should present in female, it should be not present in male. So that's why in the 7 weeks this process will start. By the time of 10 weeks, by the time of 9 weeks, the Mullerian duct will be absent in male, and in female only there is Mullerian duct. Okay, so MIS will lead to regression of Mullerian ducts in male and responsible for descent of testes, and it is also responsible to descend the testes from abdomen into pelvic area, because testes should be in pelvic area, right? So from abdomen that descent will take place, that is called as abdominal descent. So coming to remnants, some of the remnants are left in these are actually, this MIS is present in childhood, right? So their remnants are present in adult male, that is prostatic utricle. So in the present male, the prostatic utricle in the adults is a remnant of MIS, and even the appendix of testis is called as hydatid of Morgagni. So hydatid of Morgagni, appendix of testis, prostatic utricle, these are the remnants of MIS in males, adult males. So now we have understood about Sertoli cells, what it is doing. Now let us understand about Leydig cells. So Leydig cells, it is forming testosterone. So this testosterone will actually develop the Wolffian duct in male, because Wolffian duct is important in male. So this duct is responsible for development of all internal genitalia in male. So what are those internal genitalia in male? You can remember the internal genitalia in male as a mnemonic seed. So seed means S stands for seminal vesicle, E stands for epididymis, another E stands for ejaculatory duct, and D stands for vas deferens. Okay, so testosterone actually cannot directly form the internal genitalia. It forms the internal genitalia. Okay, but this testosterone also forms external genitalia. To form that, testosterone should be converted into dihydrotestosterone. When it will convert into dihydrotestosterone, then it can form the external genitalia. So testosterone is responsible for scrotal descent of testes. So testosterone will do scrotal descent, whereas Sertoli cells or that MIS cells will do the abdominal descent. Okay, so now coming to note that MIS is also produced in female. So Mullerian inhibiting is also produced in female at the time of puberty by small follicles called as preantral or antral follicle. Mesonephric tubules in the males lead to formation of efferent tubules. Testosterone is converted into dihydrotestosterone by means of alpha 5 reductase. Okay, alpha 5 reductase. So what they are saying is this Mullerian inhibiting system is also present in female. Okay, that is at the time of puberty it is present, and it is released by antral follicle. Next, coming to mesonephric tubules. Mesonephric tubules are nothing but are this one. Nothing but are Wolffian ducts, like in male, right? So in males they will lead to formation of efferent tubules. Testosterone is converted into dihydrotestosterone by 5-alpha reductase, and the most potent testosterone is dihydrotestosterone. Dihydrotestosterone is the most potent testosterone in males. Okay, so next, coming to the appendix of testis. As we discussed, the appendix of testis is derived from Mullerian duct. Because we said that the Mullerian inhibiting system or anti-Mullerian hormone is released from Mullerian duct, and this Mullerian duct is not present now in adults because it will convert into prostatic utricle and appendix of testis. So Mullerian duct will lead to formation of appendix of testis, and appendix of epididymis is derived from Wolffian duct. Okay. Next, paradidymis is derived from Wolffian duct. Paradidymis, and the prostate gland in male is a part of external genital organs. Sertoli cells at puberty, the Sertoli cells at puberty okay, will secrete androgen binding protein and an hormone called inhibin. So inhibin and androgen binding protein are secreted by Sertoli cells in puberty. First signal in intrauterine life for Lydic cells to secrete the testosterone is given by HCG. So HCG will say to Lydic cells to produce testosterone. Okay, and HCG is functionally similar to luteinizing hormone as puberty. As after puberty, luteinizing hormone will act on the Leydig cells to produce testosterone. Now let us see development in female. So female, under the absence of Y chromosome, in the female if there is no Y chromosome, ovaries develop, right? Because we don't need Y chromosome. So absence of Mullerian inhibiting substance or anti-Mullerian hormone lead to development of Mullerian duct. So anti-Mullerian hormone or MIS are absent in female because they should be absent, because in female what kind of ducts you will have? You will have the Mullerian ducts in female. This Mullerian ducts are also called as paramesonephric duct, right? So this are required for female. So this actually why they are required? Because they form the internal genitalia of female. So what are the internal genitalia of female? That is fallopian tube, uterus, cervix and upper two-third of vagina. So how to remember this? FUCV. Fallopian tube, uterus, cervix, upper two-third of vagina. These are the internal genitalia of female. So lower one-third of vagina is derived from sino-vaginal bulk of urogenital sinus. So especially we are discussing upper two-third of vagina is formed from internal genitalia, that is from this Mullerian ducts. Then what about the lower one-third? What about the lower one-third of vagina? It is derived from sino-vaginal bulk of urogenital sinus. Already we discussed whatever it which is formed from urogenital sinus is endodermal origin, but whatever is formed from female genital tract is mesodermal origin. So the upper two-thirds of vagina is mesodermal in origin, but the lower one-third of vagina, as it is formed from sino-vaginal bulk and which is of urogenital sinus, so it is of endodermal in origin. So vaginal epithelium is derived from endoderm of urogenital sinus. Okay, so absence of Leydig cells leading to absence of testosterone, causing regression of Wolffian duct. You know there is no Leydig cells in female, so no testosterone and no Wolffian duct. So causing regression of Wolffian duct. And you know, in female also there are Wolffian duct remnants. Even though they don't have Wolffian duct in female, but the remnants are present because till 6 weeks both the ducts are present both in male and female. So the Wolffian duct remnants are ephron, paraphron, and Gartner's duct. So these are the remnants of the male Wolffian duct in the female. So ephron and parapheron are remnants of mesonephric tubules, of course, because mesonephric tubules are nothing but the Wolffian ducts. Gartner's duct is a remnant of mesonephric duct. Okay, one thing you need to remember here, it is here tubule, the remnant of tubules, mesonephric tubules, here the mesonephric duct. So hence the name here Gartner's duct. Here tubules, these are tubules. Okay, so this thing which we need to remember here. Now coming to the point here, initially the Mullerian duct was lateral. So Mullerian duct means here the female duct. Initially the Mullerian duct was a lateral, then it grows above downward direction like this. Okay, so while growing downward they cross the Wolffian duct and they meet with the Mullerian duct of other side and fuse. So like this other side Mullerian duct will come. Okay, so like this they will fuse. Okay, so these remnants which we have talked like eophron, parapheron, Gartner's duct, all these remnants are actually present in a broad ligament of uterus. Okay, so they are present in broad ligament of ovary. So sometimes the Gartner's duct is present along entire length, leading to blockage forming Gartner's cyst. So sometimes on the entire length of broad ligament you will have this duct, then it is called as Gartner's cyst. So this Gartner's cyst as a blocking the way entire length. Now coming to eophron and parapheron, this can also be blocked forming a paratubule cyst. So they can also form a cyst and that is called as paratubule paratubule cyst. Okay, these are tubules, right? So they are forming paratubule cyst. Male and female internal genitalia can be differentiated by 10 weeks of gestation, because by 10 weeks the internal genitalia will be forming. So uterine cavity is formed by 20 weeks. So normally uterine cavity will form by 20 weeks, but the male and female internal genitalia will form by 10 weeks itself. Okay, and next coming to Gardner's cyst. Let us discuss about this. Gardner's cyst is located in anterior wall of vagina. So whenever you see anterior wall cyst, that is a Gardner's cyst in a broad ligament. The differential diagnosis for Gardner's cyst is Bartholin cyst, which is located in posterior wall of vagina. So don't confuse between the Gardner's cyst and Bartholin cyst, because Bartholin cyst is present in posterior wall of vagina, whereas Gardner's cyst is present in anterior wall of vagina. So this is how you need to differentiate them. Next, coming to the cyst, which is adjacent to urethra, is a paraurethral cyst. So you'll have a cyst side to urethra, paraurethral cyst. And the most common cyst in vagina or vulva is inclusion cyst. So these are some of the points which we need to remember. Next, we'll continue with the second part in another video.